How to treat feline upper respiratory illness. Feline upper respiratory illness (URI) affects a cat's mouth, nasal passages, upper airway, and possibly the eyes. It is usually caused by one or more infectious agents. Two viruses, feline herpes virus 1 FHB1 and feline calicivirus FCV, commonly cause feline URI. Bordetella and chlamydia are bacteria that can cause feline URI. Feline URI can make your cat feel pretty miserable, so it is best to treat your cat as soon as you notice signs of the disease. The sooner you treat your cat, the sooner she will feel better and get back to her normal activities. Detecting feline URI. Look at your cat's eyes and nose. Discharge from the eyes and nose is one of the most common signs of feline URI. The discharge may look clear in the early stages of disease, then become yellow and pus-like as the disease progresses. Ference ARIA label equals link to reference 4 greater than your cat's eyelids may also become red and inflamed. The pus-like discharge would indicate a bacterial infection. A URI caused by chlamydia can make your cat's eyes water. A URI caused by FHB1 can lead to corneal ulcers. Examine your cat's mouth. Feline URI can cause sores to develop in and around your cat's mouth. For example, you may see sores in the roof of her mouth, on her tongue, or on her lips. Your cat may start to drool. This is usually associated with FHB1. FCV commonly causes oral ulcers. Class equals reference ARIA label equals link to reference 10 greater than FCV commonly causes oral ulcers. Observe your cat's sneezing. Sneezing is another common sign of feline URI. Sometimes, excitement or physical activity can trigger sneezing. You may see the nasal discharge when your cat sneezes. Take note of any changes in appetite. Feline URI can make a cat feel lousy. It can also cause nasal congestion, which would make it hard for your cat to smell and taste the flavor of her food. As a result, your cat may start eating and drinking less than usual. The loss of appetite is usually more severe with FHB1 than FCV. Take your cat's temperature. Feline URI, whether bacterial or viral, often causes a fever. You can take your cat's temperature rectally or via the ear, whichever your cat is most comfortable with. Keep in mind that digital ear thermometers are difficult to position within the ear and may not provide accurate temperature readings. With FHB1, fever can reach as high as 105 degrees Fahrenheit 40.5 degrees C. Usually, the body temperature then drops to between normal 100.4 to 102.5 degrees Fahrenheit 37.8 to 39.2 degrees Celsius and 103 degrees Fahrenheit 39.4 degrees C. If you do not feel comfortable taking your cat's temperature, your vet will do so. Take your cat to your vet. When your cat is showing the telltale signs of a URI, take her to your vet. Often, a diagnosis of URI can be made based on the clinical signs. If your vet wants to determine the infectious agent causing the disease, they will perform other diagnostic tests, including an analysis of the discharge from your cat's eyes, nose, or throat. Your vet may also take a small skin sample, a conjunctival scrape, from the inside of your cat's eyelids. Treatment for feline URI is generally the same regardless of the infectious agent, so your vet may decide not to test for viruses or bacteria. If your vet suspects the infection has traveled down into your cat's lungs and caused pneumonia, they may take a chest X-ray to look at her lungs. Treatment for feline URI is generally the same regardless of the infectious agent, so your vet may decide not to test for viruses or bacteria. If your vet suspects the infection has traveled down into your cat's lungs and caused pneumonia, they may take a chest X-ray to look at her lungs.